Hey everyone, Dr. Ritza here, downtown Toronto chiropractor, acupuncture provider, and manual therapist. And today what we're going to talk about is the core. So after I've given my patients some instruction on how to abdominal brace and hollow, and they've mastered the ability to hip hinge, what we move on to is what I call my big three. So Stu McGill, the University of Waterloo, talks about his big three, which is the bird dog, the side bridge, and the crunch. I find that most patients either get some low back pain when they work on the crunch or are not able to do properly and actually might provoke more harm to the low back. So what I do is I replace the abdominal crunch with a glute bridge and try and focus on activating the glutes and building some strength in those, which is often lacking in people with low back pain. So for any of these exercises, what we're going to be doing, if they require a hold, such as with the glute bridge or with the side bridge, we're going to do the hold for about 8 seconds and take a break, and then 8 seconds again, and you do about 5 8-second holds with 8-second rests, and that's one set, and you do 3 sets of those. In terms of the bird dog, what we're going to be doing is you're going to use either each arm and leg together or by themselves 8 times, and that's one set, and you can do 2 to 3 sets of those based on what you're a manual practitioner or what I recommend to you. The cue that you want to remember for all of these exercises is that you want your core to be nice and tight, using that abdominal brace that we've worked on in the other video, making sure that when needed the glutes are tight. And the cue for that is like you're trying to hold a loonie between the glutes so that you know they're nice and tight and they're supporting the low back. You also want to make sure that with the brace, you're maintaining that nice neutral spine, so a slight hollow in the low back, and breathing throughout. If any of the exercises hurt, you want to cease and desist and let either your doctor or manual practitioner know that they hurt, and they might be able to find another exercise that works for you. With any of these exercises, you want to work on them as much as possible. If you can get up to doing them 2 or 3 times a day, all the better, and they are something you can do every day. Because you're only using about 30 or 40% of your maximum core strength, it isn't something that should cause injury or should cause too much fatigue that you aren't able to do it a couple times a day. And the more you do it, the more it's going to recreate using that core strength throughout the day, throughout your daily activities, or any sports that you might play as well. Okay guys, so this is the bird dog. What the bird dog is, you're going to be on all fours on a nice cushy surface such as a mat or carpet at home, and you're going to be on your hands and on your knees. You want to make sure that your wrists are beneath your shoulders and the knees are beneath the hips. You want to have a small little dip in the low back, such that you could support a glass of water on the low back, and that the low back isn't going to move, so the glass of water would stay there throughout the exercise. You also want to make sure that you have a nice core contraction, always using that abdominal brace that we've worked on. What we're going to do is we're going to use at first a single arm movement and a single leg movement, and eventually progress to using the arms and the legs at the same time. Another fantastic cue for the bird dog is you want to make sure that while the chin is tucked, you also want to breathe nice and easy, and make sure that when the arms and the legs move, pretend that they're following along a train track and that they can't deviate from them, so that they're going on 2 straight lines in line with the shoulders and the hips. So for the bird dog, we're going to demonstrate just that. We get on our hands and knees. You can see my hands are beneath my shoulders, my knees beneath the hips. I don't have a huge hollow in the low back, and there's not a round in the low back. It's nice and flat. If I were to touch my tummy, it's tight, and my chin is nicely tucked. And so what we're going to work on first is just maintaining that brace while we slowly raise up the arm, which is going to work on strengthening the thoracic paraspinals as well as the shoulder, and bring it back down. You can work on bringing the arm up next, the opposite arm, on about a 1 or 2 seconds up and 1 or 2 seconds down. And what's really important is you notice that my body doesn't shift throughout the movement, and if I had a glass of water in my low back, it would stay there. So when we go on to moving the legs back, we want to make sure that the legs move slowly along the ground, along that imaginary train track, and that we're going to work on not overextending the back, but rather trying to engage the glutes at the end of the movement. So what that's going to look like is that left leg is going to come back slowly and about to parallel. You notice that my trunk doesn't shift or change directions, and that I maintain the small of my low back. I'm not hyperextending the leg or hyperextending the low back, but rather when I come back, I can feel that my glute engages while my core is tight. On the way back in, nice and slow. Again, on the other side in real-time motion, it comes nice and back as my core is tight. I can feel my glute engage at the end, and then I come back to neutral. The progression for this exercise is when we're going to move both the arm and the leg at the same time, the opposite arm and the leg, and how that's going to look while the main low back maintains a nice small curve and the core is tight. Arm and leg opposite, little pause at the end, and back in. And without losing that neutral low back, and that neutral spine, out and back in. It is quite a tough exercise for beginners, but something even like to recommend with people who I've been seeing for a long time and who have excellent core strength. You can do some other modifications where you add in resistance bands or crunches in with it, and we can talk about those in a later video, but a fantastic exercise to strengthen the low back and the thoracic paraspinal muscles as well. Hi everyone, so this exercise is obviously the side bridge. This is one of my favorite exercises for not just good core strength, but also conditions revolving around the hip. It requires a lot of activation of the gluteus minimus and the gluteus medius on the side of the hip, which are responsible for hip abduction. This is a fantastic exercise for somebody after they've learned to abdominal brace and hollow and work on their hinge for building strength in the obliques and for that lateral line of muscles on the side of the body. So a couple cues for the side bridge that's most important, like we already talked about. Nice and tight in the core so that we're not falling down towards the bench, but rather nice and tall, and we have a little bit of an arc or a bridge underneath our arm. And something that most people fail to do during this exercise is make sure that the glutes are nice and tight. And again, the cue for that is like we're trying to squeeze a coin between the glutes. For this exercise, what I usually recommend to patients is actually just a small little 8 or 10 second hold when we get started, and after that hold, slowly lowering towards the ground in a straight line. After a couple seconds of rest, 5 to 8 seconds again, back up, repeat that 5 or 6 times, and then 3 sets of that. I'm also going to show you the side profile of one of the most important things in maintaining a nice flat line between, or straight line between the ears, the shoulders, the knees, and the hips. So here we can see the side profile for that side bridge that we've been working on with the knees bent. And one thing that I really stress with all my patients, we want to make sure that the ear, the shoulder, the hip, and the knee are nicely aligned. Most people get into trouble with this exercise where they fail to either keep that body alignment or to activate the glutes, and you might find people that are back here and they just really need to bring that pelvis forward by tightening the glutes, and then that really helps with the posture. Some other people will get stuck where they're a little off line or they get the shoulder tilting a little bit forward, but we do want to make sure that the two shoulders are over top of each other, and you can do that or correct that by putting a little hand on the waist and pointing the elbow up, and that should give you some better alignment and just maintaining that nice high arch on the side. Hey everyone, so the exercise we're going to do next, which is part of my big three, is the glute bridge. So with the glute bridge, we're working on isolating the glutes and getting them to turn on and activate without extending the low back too much and keeping the hamstrings nice and soft. For this exercise, you're going to need something flat and cushy to lay down on, and a resistance band or a TheraBand. So for this, we take the resistance band, we wrap it around the legs, and it's going to sit on the thighs just below the knees. So the next thing we're going to do is we're going to lay back on our bench, nice and soft. If you need a pillow under the neck because you're suffering from neck pain, please do that. So with this exercise, what we're going to do is we're going to do 3 sets of 10, holding for about 8 seconds, and we're going to work on lifting the pelvis up off the ground by engaging the glutes and not the hamstrings. So what that's going to look like is kind of going to feel like somebody is pulling you towards the sky, and you can feel, you can get somebody to touch you, the glutes are tight, and if I reach down to the hamstrings, they're nice and soft. You work on holding this for 8 seconds. I have the resistance band here because it helps to make sure that it activates that gluteus maximus muscle, which is an external rotator of the leg, and stops the knees from collapsing inward. So after our 8-second hold, we come down, we take a break for a little bit, and then we come back up again. And you'll notice that I'm not overextending my back because the purpose is just to work on activating those glutes and not the low back too much. With the other exercises, the core is nice and tight, and we're using that same cue of activating the glutes. We're trying to hold the core between the buttock muscles. So we go down again. Hey guys, so we're in another position here just for our glute bridge that we've been working on. I just want to show another angle so you can see how it works. Here I've actually got the TheraBand a little low, and we want to make sure that we raise it up, and that when we elevate, we're activating the glutes. And if you were to reach down and feel my hamstrings, they're shut off and they're nice and mellow. You'll notice that the resistance band stays nice and wide with my thighs when I go up for my glute bridge. It is not collapsing in under the resistance of it. Core is nice and tight, low back is in a nice neutral position, and we hold that for our 8 seconds. Fantastic exercise to do as a warm-up before you're doing your squats or your deadlifts, or a great component to any core exercise plan to make sure that the glutes are firing and not causing overcompensation in the low back, and also working to turn off those hamstrings actively.